Thank you and good afternoon. Today we are reporting on 673 new cases of COVID-19 in BC, including 6 epidemiologically linked cases, bringing our total number of people diagnosed with COVID-19 in BC to 44,776. Of the new cases, 145 people were in Vancouver Coastal Health Region, 403 people were in the Fraser Health Region, 4 were in Vancouver Island Health Region, 66 people were in the Interior Health Region, and 47 in the Northern Health Region. In addition, we had 8 new cases in people who normally reside outside of Canada. We now have just over 10,009 active cases, of whom 358 people are in hospital, 93 of whom are in critical care or ICU. We also have 10,388 people under active public health monitoring because of exposures to COVID-19, and 32,963 who are recovered. Sadly, again today, we've had 21 new deaths from COVID-19. The majority of them, again, are seniors and elders in long-term care, bringing the total number of people who've died in British Columbia to 713. My condolences go to the families, to your care providers, and to communities. We feel your loss, particularly at this time of year and this time in our pandemic. We have no new healthcare outbreaks to report, leaving us with 55 active outbreaks in long-term care and assisted living and 6 in acute care units. That includes 1,374 residents and 735 staff with COVID-19 right now. There have been 2 new outbreaks in the community, one of them at Wingtat Game Bird Packers, which is a poultry processing plant in the Fraser Health Region, and the other, the diversified transportation employees connected to LNG Canada. As Minister Dix mentioned, next week we'll be providing a data update to show some of the progress over the last month and where we are in the pandemic right now. On a positive note, of course, we know that vaccine has arrived here in British Columbia, and in the last day, up until yesterday, 1,215 healthcare workers have received the COVID-19 vaccine, and that is a great testament to the work of the public health clinics and to healthcare workers who have stepped up to do their best. Starting next week, we will be receiving weekly vaccine deliveries, and it is a moving target, and we are receiving updates about amount of vaccine and when it will be received, sometimes multiple times a day. But we do expect and are planning for immunization clinics in every health region across the province starting early next week. And I know many people are eagerly awaiting this. As you can imagine, this is a national effort, and we get deliveries and processes set up, and things are rapidly changing, and timings will be provided as soon as they are confirmed. And I've received a number of questions about the vaccine, but one of them that I've received from a lot of people is why the vaccine is not recommended for people who are immunocompromised, and what exactly that means. For some people with an underlying health condition who are undergoing certain treatments or on certain medications, it lowers their ability for their body to respond to viruses, and we know that that makes people more at risk of having severe illness with COVID. But it also means that they may not respond as well to certain vaccines as well. This would apply to people who've had an organ transplant, for example, have chronic liver or kidney disease, someone receiving chemotherapy, or certain immunosuppressive therapies. If you're wondering if this applies to you, because it's not all kinds of immune conditions, the best thing to do is to consult with your healthcare provider. The reason that this vaccine is not yet recommended for people who are immune compromised is because the clinical trials expressly excluded people with those conditions and focused on primarily healthy populations of people of different ages. So there were very few people who did have immune compromising conditions who were in the trials. So what that tells us is that right now we just don't know whether these vaccines will work and whether they're safe or whether they may have some effects on the immune system. Having said that, this is a recommendation from our National Advisory Committee on Immunization, who reviews all of the data that we have on safety and efficacy, so how the vaccine works. But it also, part of that recommendation is to make that decision with your care provider on a case-by-case basis, whether the risk of being infected with COVID outweighs the risk of receiving the vaccine. So that is something that will have to be done on a one-on-one basis for people who have immune-compromising condition as we learn more about this vaccine. It is also, of course, important to understand that while we continue to respond to the COVID-19 pandemic, if you need medical care, it is available and it is safe in hospitals, in healthcare facilities, and in primary care clinics across the province. You do not need to delay appointments, and if there's a reason to call 911 and you need emergency care, don't hesitate. It is safe to do so. As we have evolved our approach with COVID-19 and learn more about the virus and how it is affecting people, and we learn more about the tests and how they work, we have recently updated our approach to testing to ensure that those people who most need to get a test right away realize that and do that. And we also recognize that for some people, it might be okay to stay away from others and to wait and see if you need a test. Here in BC, the majority of new cases continue to be directly connected to somebody we know has a confirmed case or a cluster or an outbreak. So if you have been in contact with anybody, or you've been part of a cluster, or there's something going on at your workplace or in your social group, and you have any symptoms at all, you should arrange to get tested immediately. What we want to do is focus where people know that they need to get tested immediately. If you've not been around anybody that has COVID, and we're updating the guidance to make it clearer for people. It's not that you can't get a test, but there are certain people that we want to get a test right away. We know that many of the symptoms of COVID-19 are similar to other respiratory illnesses that we see this time of year, influenza for one, but other colds and respiratory infections. There are 4 symptoms, though, that have shown, when we look at the data of people who've been tested, that are very much associated with COVID. And these include having fever, chills, a cough, loss of sense of smell or taste, and difficulty breathing. If you have any of these symptoms, if you're feeling short of breath, if you've lost your sense of smell, then you need to get a COVID test right away. That's a priority. Even if you've not been around anybody with COVID, you need to get tested right away. There are other symptoms, though, that also happen with COVID, but on their own, they don't necessarily mean you have the virus. Those are things that are fairly common this time of year, like sore throat, loss of appetite, fatigue, headache, body aches, nausea, and diarrhea. So those, in that case, if you have 2 or more of these symptoms, you can wait and see, but you can also go for a test. And if you feel the same or worse after 24 hours, then you can get tested. So it really is to make sure that if you have any of those worrisome symptoms, that you do go for testing right away. And if you've had any contact with somebody who has COVID and you have any symptom at all, again, you must go for testing right away. If you're uncertain, you can call your health provider or 811. And as always, if public health is doing investigations, there are many times that we tell people whether they have any symptoms at all, they're asymptomatic, that they still need to have a test. And we do that in workplaces, we do that in long-term care, and when we're investigating outbreaks. I've spoken many times about BC's COVID-19 response, whether that's the orders and guidance, the changes in long-term care, and now, of course, the vaccine. If there's one thing that we have learned, it's that to keep our wall strong, we need a team effort. We are a team made up of frontline healthcare workers, other frontline workers, our contact tracers, and, as I had the pleasure of seeing earlier this week, our immunization teams now who are providing COVID-19 vaccine. It's also the hundreds and thousands of people across BC who are doing your part every day, at work, at school, and at home. Together, we are using our layers of protection and following all of the public health orders, keeping our groups small. And this is more important than ever, especially as we go into this holiday season. Together, we are making a difference. Many people have already decided to make their holiday celebrations safe celebrations. I've also made that commitment to celebrate safely, to stay small, to keep my community and the people that I care about most safe during this holiday. I ask you, please, to do the same. Make the commitment today to have a safe holiday celebration. We may be days away from the solstice, the darkest and the longest night of the year, but without a doubt we have light ahead, and we can't let all that sacrifice that we have done together in this past year be all for naught. What you do makes a difference and is making a difference today. The efforts you make mean that we will all be safer as a result, and we will get through this pandemic. So let's together make this holiday season a safe season for all of us, and continue to be kind, to be calm, and to be safe. Thank you.